So you wanna make
Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons, on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Drs. Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz Podcast will surely satisfy your podcast fix. All right, now let's dive into this episode.
Welcome back to the Fuller Butz Podcast. This is Dr. Butz and Dr. Fuller. We're back for another episode. We just wrapped up last week talking to Smith & Crawford Company, marketing experts in the aesthetic industry. That was a pretty exciting conversation, and I definitely learned a lot from them. Any takeaways, Dr. Fuller?
I am going to try to not be as monotonous.
Yeah, they really hammered you pretty hard on that one. Me too. They just weren't talking. They talked to you once.
Yeah, I don't know. I think they were talking to both of us. So we're going to try to be more animated, more excitable, and just really emphasizing things that are important, right?
Yeah, lots of enunciation and high energy. It's going to be awesome.
Yeah, and I if we haven't lost the listeners already, it's just us. We don't have any other cool special guests, but we're going to give it our best, and we're going to shift it back to the plastic surgery world. Dan, how's your plastic surgery world going so far this week?
Yeah, and taking a little venture outside of plastic surgery this week, though. I'm actually doing a pig heart dissection tomorrow for my kids' grade school. They have this like high interest day where parents come in and kind of really do demonstrations for a whole host of things, not always related to their specialty, but something like pizza cooking, grilling, tie-dyeing, and my buddy and I came up with the idea of doing a pig heart dissection. And so, yeah, I had to review some of the pig heart anatomy to refresh my memory, and it should be kind of fun. Mostly 7th and 8th graders, and yeah, just get their hands dirty a little bit and learn a little bit.
So what's the age of the pig? Have you gone through the risks and benefits of what you're going to be doing with him?
Yeah, most of the pig has been turned into bratwurst here in Wisconsin. But yeah, nice butcher donated them to us. So should be a good learning experience for the kids. What about you? How's your week been?
Good. We just had another Little League baseball game today. It's second this week. The boys are enjoying it more and more, trying to figure out the rules and make sure that they run as fast as they can, hit the ball as hard as they can, and make friends and have fun with it. So the weather's been beautiful this week, and I've been on call, so it's been a little bit busier, but mixing in some family time and some call cases, some interesting plastic stuff. So continuing my wide array of surgical interventions and getting ready for a great summer.
Yeah, it's definitely starting to heat up. It was like 80 last weekend. It was just, beautiful. We've had some pretty crazy storms blow through, but speaking of bats and baseball, too soon?
Well, I was thinking more of just the heat. So the humidity, and then you start wearing T-shirts and tank tops, and I get some patients right around now who just say that they're embarrassed or afraid or don't like wearing short sleeve shirts or tank tops because of their upper arms. And so Dan and I thought that what a great mini Q&A and info session for this week's podcast, but to talk about brachioplasty or arm lifts.
Yeah, it's arm contouring, arm surgery. Like all these things we talked about, there's a whole host of things you can do. So the arm lift or brachioplasty is kind of the probably gold standard to address loose arm skin. Some people call it the bat wings, hence my slight reference to a bat there. And there's other things you can do as well, right? So what if patients come in saying they just don't like their arms? Like what do you tell them the options are?
Yeah, I mean, arms and the extremities are a big topic these days. And a lot of times you just have to identify what the patient doesn't like about them. Like, what is it specifically? Is it some loose skin behind the elbow? Is it veins that are more prominent in their back of their hand? But assuming we're talking about the upper arm, I really need to understand more information about the patient, like their age, where they are as far as their weight goals. Like, are they at weight and this is just how their arms have always been, just a little flabby, a little bit loose, and they want things to be tighter? If they have, I would say, as a younger aged patient with more elasticity, liposuction only is one option. Another option would be, just fitness, health goals, trying to do things non-operatively. I have not seen great results with more expensive in-office treatments such as cool sculpting or some of the other trends that are there. And I don't own those either, so I can't really speak to that. But I would say if patients are really burdened by both excess skin laxity as well as bulk, then the brachioplasty or arm lift can be done. And, I don't know, what do you give them as options?
Yeah. I mean, I think like you're alluding to, the younger patient has good skin tone, but maybe a little bit more fullness than they like. Liposuction can be a great option to just kind of thin things out a little bit. But I think like we've kind of mentioned in previous podcasts, like with thigh liposuction, the underarm, the arm skin's a little bit thinner. So you have to be a little bit more conservative to avoid dimples and rimpling, but you can definitely make some nice contour improvements with just liposuction. And I frequently will add in Renuvian on those patients to try to cinch up the skin a touch. Doesn't replace arm lifts though, for a lot of loose skin. And then we do use cool sculpting. We have M-Sculpt, Cool Tone, which are more for muscle development. We've had some great results for, kind of optimal patients where there's just some fullness, pretty significant reductions. But those are a little less consistent than surgery, but they can be pretty dramatic at times. But then I think the bigger cases, the bigger kind of wow factor for the arms are these big skin reductions in either patients who've lost a lot of weight or just genetically, just are prone to loose arm skin. I feel, sure you've had this as well. Patients can be like my grandma had these arms, my mom has these arms, I hate these arms. How can I improve this contour? It's kind of, they're at an optimal BMI. There's really nothing they can do to tighten up that skin. And the arm lift is really the gold standard to give them that contour they're looking for.
Yeah, so let's break that down into more simple terms, because you threw out a couple of different key points that I want to hit home. So one is, today's topic, we're talking about brachioplasty or arm lifts, which is when patients come in dissatisfied with the overall bulk of their arms. You mentioned some non-invasive in-office treatments. And you said, of course, they have to be optimal patients, like the right patient. But like, so who, if someone's listening to this, like, who is the optimal patient, or who would be a candidate for an in-office procedure to tighten their arms?
So I wouldn't say it's tightening. The in-office procedure, cool sculpting and reduces fat. That, ideally you have good skin tone and you're trying to shrink that fat by, cryolipolysis, which is basically it's really cold and then the fat cells die. Cool Tone or M-Sculpt are devices that stimulate the muscle and can make muscles grow. Typically, it's used for the six-pack muscles and the butt muscles to make the butt bigger, the abs flatter. But there are some applicators for the arms. So the optimal patients are, just need a little bit of fat reduction to see an improvement there, not a lot of loose skin, not kind of the latter patients I spoke of losing a lot of weight or kind of genetically having a lot of loose skin. Liposuction, again, probably same patients, but some patients don't want surgery. Surgery is probably a more reliable result in most cases, but there's also a little bit more downtime with surgery.
So if I'm listening to this, if I'm hearing this correctly, if I've maybe have not had drastic weight changes, have a normal height, weight, average, or BMI, would that be the candidate for a non-surgical treatment? Is there an age limit? Like who, someone who's seriously wanting to sign up to Quintessa, what's going to make them, who's the perfect, candidate? Can you be more specific?
I'm not sure if I can be more specific. Some fullness and reasonable skin tone and not a lot of loose skin. Age, I think, is, not all that big of a factor. When you get, older and have more generalized skin laxity in the 70s, maybe it's not going to be as effective because, again, general skin laxity. But, the non-surgical patients can also be a surgical patient, but not everyone wants to have surgery. So we often have patients, they call in, they kind of talk to our, kind of aesthetic advisors about what direction they're looking at. And if they would prefer non-surgical, they see our non-surgical body contouring specialist, who can then evaluate them, see if they're a good candidate. And if they're a better candidate for surgery, they pass them, recommend that they come see us. I think that's one of our strengths as a center, having different specialists in different areas, is that no one's going to get forced into just doing cool sculpting because that's the only device we have. We have all the devices and surgical options kind of at our disposal, which I think is, frequently I see referrals or second opinions of patients who, have had multiple rounds of cool sculpting. It's just not working, and really they should have never really had it to begin with.
Yeah, I think, just as we were thinking out loud about that, I think it's true. I think you kind of have to see it or hear about it on a patient-specific basis. I don't think it's going to be it's for everyone 37 and under. Like, that's just simply not the case. Everyone is so variable. And
yeah,
I think that phone consultation is key. A lot of times I have patients come in for a consultation and we talk about it and say, hey, you know what? The outcomes of a brachioplasty, a surgical intervention, do not outweigh the advantages of doing something non-surgical. And so I'll refer them to a med spa locally, refer them to some non-operative measures, because it's just not worth the cost. And I would say the downtime is not significant, but there's other, disadvantages and, pros and cons to everything. So I would say on a case-by-case basis, almost, I agree with you. It just needs to be, someone who doesn't have a ton to lose, maybe a candidate for something that's less invasive, which is important. Patients just need to know that there are options. They don't have to just live with that. If we're shifting into the surgical category where patients are like, okay, putting some pads and zapping and freezing my fat and tightening my muscles and stuff is just not going to cut it. I don't like when I'm clapping for my son as he's hitting the ball off the t-ball, and the reverberations of the arms is going back and forth. And then we start talking about brachioplasty. And so in your opinion, can you walk me through what like a liposuction only brachioplasty would be?
Again, it's very similar to those non-surgical patients. They don't have they really don't have any loose skin or very minimal loose skin, just have some fullness. So there's really not, reverberations when they're clapping. They just don't like how full it is. So you can debulk it a little bit, thin things out, mostly targeting the skin in the underarm. And the skin on the upper shoulder area generally isn't as favorable because you're going to be higher risk for seeing some contour abnormalities. So again, those patients overlap quite a bit, but a lot of it comes down to goals and kind of what they're looking to do. Again, downtime isn't that bad, but still it's typically requires surgery, small incisions, and more compression garments to optimize the result.
Yeah, I think brachioplasty, liposuction only, just small access points in order to harvest and remove the fat, some compression garments, but, they're really, I would say their pain is tolerated. They're not laid up. They're moving and using their arms the same day. Like there's not like they're in hiding or they're going to be hurting for a long time. A lot of times brachioplasty, especially a liposuction only, can be combined with other surgeries. So if they're doing a breast augmentation or doing an augpexy or breast augmentation with a lift for like weight loss patient, a lot of times we'll combine the arms with those. And to me, the arms are, not necessarily the most significant recovery that I'm waiting on in the weeks that follow. To me, it's the patients just tend to fly. That's one of my favorite, weight loss surgeries to do. I don't know if it's just because I'm on the arms all day with my hand practice or whatever, but brachioplasties to me are just fun. The results are instantaneous on the table, and they can be combined with other, procedures.
Yeah. So, I mean, going to the bigger, more extensive skin excision, I mean, there are different versions of brachioplasties. Do you want to kind of go from, so people often come in asking about mini arm lifts or brachioplasties, the more traditional versus kind of extended. What's your kind of approach for describing those differences and what you could expect for the outcome?
Yeah. So, when we're evaluating a patient's arm and we see that there's skin redundancy with bulk, I talk to them that, to get the desired result that they want, it's going to be a full brachioplasty, which is a skin excision of a certain length, depending on the amount of volume that they have, following a liposuction procedure. So typically a brachioplasty is an outpatient procedure, takes about an hour and a half to 2 hours. I usually begin, regardless of the incisional length, with liposuction. So I inject the tumescence, which we learned about a couple of weeks ago on our anesthesia podcast. So it's injecting some epinephrine to decrease bruising, bleeding, and some local to really keep the pain level down. And the liposuction is great because we're removing some bulk, but we're also just creating the plane to follow, or creating the anatomical field that we then identify during the excision, and that just keeps everything superficial. We can talk about hiding scars, but when I see a mini brachioplasty, that just means that the incision is within the upper arm. It's not extending past the armpit or down past the elbow. I don't see a lot of those. I'd say, if we're going to do a brachioplasty, typically it's a standard, which is pretty much just proximal to your funny bone or your medial epicondyle. Try not to extend any incisions across the elbow, across any joints, and that pretty much ends up right in the axilla or the armpit, where your sweat glands and your hair is. I've had a few patients recently ask me if I can just cut out their armpit with the arm lift. If I can just remove their sweat glands and stuff, and that is not part of a traditional arm lift, at least in northern Indiana. Do you have any comments?
Yeah, I would say typically when patients ask about the mini, or can we make the scar hidden and keep it the other direction in the armpit, it tends to be a very mini result. So you're removing some skin, it tightens up a little bit, but it normally isn't worth the scar because it's not as dramatic of an improvement. So I think we're not do a lot of those because we want to make sure it's, the downtime isn't that bad. We want to make a dramatic, improvement and really get the result you're looking for, not just the smallest scar possible, because that tends to not deliver as extensively.
Yeah, I think a large part of our conversations and consultations is just convincing patients not to cut corners, that, hey, if you really want this is the picture you're showing me, or this is the result that you want, you're squeezing your skin together in your upper arm and say, I want it to look like this. There's not a machine that can do that. There's not a mini technique that can do that. You're essentially opening up that area, closing it up. And I think sometimes lengthening the incisions actually help keep tension off of the skin to allow for the closure to be great. Because I think some of the side effects or some of the negatives of any plastic surgery are bleeding, infection, scarring, visible scarring, hypertrophic scarring, and recovery. And I think if we, as plastic surgeons, are aware of those and can minimize those, that's where the home run is in convincing patients that, hey, yes, there will be a scar from your armpit to your elbow, but we have techniques to really hide that, so that if your arm's at your side, your arm is looked at from the front or the back, oftentimes that scar tends to be very minimal and obscured or hidden.
Yeah, I think, I'm also very transparent with patients. The biggest trade-off of an arm lift scar, I mean, there's always risk with everything, but most of those risks are pretty minimal in terms of infection, bleeding issues. The biggest risk or downside of the arm lift is the scar. Because, if it's down by your side, you don't see it. But if you're cheering, if you have a short sleeve shirt on, the scar is going to be visible. There's no way to hide it in all animations. It's not easy to hide under a bra or underwear, swimsuits, bikinis. So I think I'm very upfront about that. We can ideally get the scar to be fine and fade it to a faint white line. But depending on, how much you tan or skin, how you scar baseline, there's likely going to be some visibility there again, if you're moving your arms to a normal degree. So I think that, that's what I think it's really important to understand that going into it. Some of them are almost hard to find, but everyone scars differently, and that thinner skin in the arm is more prone to stretching, especially with how dynamic the arm is. So typically it's not as fine line of a scar as, a lot of our abdominoplasties or other areas.
Yeah, obviously you have to tell the patient, but to me, it's usually a pretty easy sell when they've hated their upper arms for years or just feel like they can't wear, shirts and sleeves that are, exposing those. And so they, cut it, give me the scar. And, knock on wood, I think we do have surgical techniques. We have suturing, we have post surgical scar remodeling and treatments and stuff to really help that fade away. But yeah, there's no guarantees in life. We can't guarantee scarless healing. That's one of the biggest drawbacks, is that, there's going to be a scar that length, but it's all about, the end result of getting a tighter, more conformed arm. And I think another thing that I tell patients is that it needs to look natural too. So you don't want to over tighten the upper arm, as they're saying, take as much of it as you can. It really needs to fit with the natural funnel kind of shape of the arm, where you're going from the wrist to the forearm to the elbow to the upper arm and the axilla. If your upper arm is ultra tight, it's just going to look very weird and unnatural if it's tighter or it's not as as natural looking and aesthetically pleasing as the rest of the arm. So that's something else where, I'm not going to wrench it and york it as tight as I can just because I can. It needs to fit with the rest of the body that's there.
Yeah, pulling things too tight is likely going to lead to not as great of scars and wound healing issues. So absolutely want it to all blend in nicely and match the rest of the body. But I think you can, end of the day, a lot of times we're removing 3-4 inches of skin in some of these patients, and it can be very dramatic and huge, results, and allow them to feel more comfortable despite the scar, wearing sleeveless shirts, tank tops, whatever that might be, working out, playing tennis, clapping at their baseball games. So it's for those patients, it's totally worth it. But it's those kind of in-betweeners where it's a little bit of laxity. It might not be as dramatic, where it's this is a big scar, for maybe less dramatic of a result. So that's where talking to the patient, having this conversation, and really just weighing out all those different options and what they can expect, and what you can deliver is really the important thing.
You alluded to extended brachioplasty. Do you want to talk a little bit about what that means?
Yeah, this is more common for patients who've lost a lot of weight, where there's skin laxity everywhere on their body. Maybe we've done a torsoplasty, a breast lift already, and then the arm. Sometimes there's still laxity kind of in the upper back, lateral, kind of side of the chest, and you can take that arm scar and kind of run it down the chest along the the inseam sort of area to take up more loose skin. So we're often in those patients trying to take up extra skin wherever we can and kind of blend these scars together. So the extended just means that it's a longer incision, which normally is then going beyond kind of some of those flexion points of the armpit. I don't like to go past the elbow as much, but if it needs to make it smooth and transition nicely, we can chase that out a little bit.
Yes, we talk about chasing out a dog ear, or if there's extra fold or extra laxity at the elbow. How far down the side of the body are you willing to go during an extended brachioplasty? Typically,
I'll go to where the end of the breast kind of ends, is kind of the lowest I'll go. Sometimes I'll blend it into the breast reduction or breast lift scar that may already be there. So yeah, that's kind of the ending point is.
Yeah, I'm the same way. I have the same limit where you just can't, you could keep going all the way down, almost like a stocking type of incision. But I just tell them, we're starting to treat your back. We're starting to treat, some laxity in your breast, your abdomen. When we go down lower and lower, essentially that is no longer an arm lift. It's more of like a side body lift. And so you have to draw the line somewhere, but we can certainly extend it beyond. Sometimes we use curved or zigzag lines at the axilla or the armpit in order to avoid any scarring or webbing of the armpit. That's called the Z-plasty. And then I think, Dan, you're with me in that we rarely, if ever, use any drains for brachioplasty. So it tends to be liposuction, internal stitches, dissolvable stitches in a layered fashion, and then sealing it up with a nice adhesive dressing and wrapping it with compression. Is that your technique?
Yep, exactly. skin tape and compression for, like good compression for the first 3 to 4 weeks. Then you can lighten it up a little bit, but ideally for something for 6 weeks is what I generally recommend.
Yeah, so I tell patients, in and out, same day. You can be typing, texting, hair and makeup, can be driving the next day, off of pain meds within a day or so. Not excruciating pain. It's more of the awkwardness of the compression. I usually give them ACE wraps for the first day or so, just because I think they're easier to wrap and unwrap just because of swelling, pain, and then they usually shower 48 hours later. After they shower 2 days later, that's when they switch into whether they have like a vest or they have a nice compression garment for arm lifts. There's a ton of great options that are available. Some of them are including with the bra, some of them are without. Then they switch into those, and they're wearing them pretty consistently. And I have patients golfing really full go within 5 to 6 weeks after the procedure, really letting it heal, trying to allow that scar to really fade so that the downside of the arm lift as far as visible scarring is minimized, and then setting them free and letting them really enjoy their lighter arms.
Right. Yeah. I mean, pretty much the same thing. I like ACE wraps early on. I think they're easier to get it, to maintain the compression and on and off for this first couple of days. Then once they're comfortable getting the sleeves on or whatever their garment they like. And yeah, I mean, it's a very powerful procedure for those patients with a lot of loose skin. I think it'd be really kind of liberating to allow them to do all those things they want more freely, not wearing long sleeve shirts all summer long. So yeah, what else? Did we miss anything? I think we hit liposuction, non-surgical, minis.
Yeah, I mean, I think the gray area as far as surgical versus non-surgical, I think we kind of hammered that out, is that it just needs to be a case-by-case basis. Like, we just got to hear and see your arms and see where you would fit. Neither of us are really pushing one or the other. You have options within your enterprise at Quintessa. I have friends and colleagues in the community that I refer to, and vice versa. And you just want to, as you, I think, mentioned a couple of podcasts ago, do the right surgery the first time and not, shortcut anything and not be forcing them into, something that's longer or more expensive. So we're just, I think this is a relatively straightforward topic and something that we can talk about in, future seasons. But arm lifts are fun to do. They're one of my favorite procedures. I love hiding that scar in the upper arm and seeing the patients come back, sometimes very tearful and emotional 1 to 2 weeks out, having their arms that they've hated or have tried to do everything for be treated and improved and enhanced. And it's why plastic surgery is so intriguing and almost addictive as a surgeon. Like, you just want to keep making things better. And I don't know, any other points from you, Dan?
No, I think we're going to follow this up next week, going to the lower extremities, correct? Hitting up the thighs, which similar but a little bit different kind of concepts.
Yeah, they're different arms. They're kind of like longer with feet attached to them. But no, I think thigh lifts, outer, inner, there's a lot, obviously, of need and interest in patients who want that to get better. And so we can talk about that next week. I think that would be a good sequential informational podcast.
Excellent. We'll see you then. Have a good weekend.
Good luck. Get some sleep about this heart dissection for this piggy. I want it to go well. I want to hear about it next week.
Pulmonary valve, mitral valve. I'm ready.
Yeah, you'll get it. You're good.
All right. See ya.
See ya.
Thanks so much for tuning into this week's episode of Fuller Butz, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butz are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @FullerSurgeryMD or @DanielButtsMD. That's Butts with a Z, for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butz.